Informed consent has to do with allowing families to know the risks and benefits of any test, procedure, recommended thing that we want to do, telling them why is it recommended, what are the benefits of it, what's the risk if you don't do it, and then having the family have ownership of that and the ability to say, okay, I understand, I want to proceed, or I understand and I don't, and that's okay.
Informed consent to us is the whole thing of also, I'm not treating you for pregnancy, I'm partnering with you in pregnancy. And so it's the simple thing of giving you the information, giving you the evidence of this is the recommendations, this is why it's the recommendations. And then it's having a conversation. How do you feel about those recommendations? How do you feel about the evidence? And then it's also leaving space and opportunity for you to do your own research. And then for you to come back to the birth center with me and say, I've done more research, this is what I'm finding. We trust you, we trust your knowledge. And so we'll come to the table, we'll have those conversations, and then we're gonna support you in the decision you've made for your family.
Informed consent is one of my favorite things about being a midwife. What it means to me is offering people safe choices. A lot of us are accustomed to coming into a clinic environment or being in front of a doctor and just kind of being told what's going on, and you kind of just are like, okay, you're in a white coat, sure, yeah, whatever you say. And in this setting, we really want to empower our families to kind of make choices that are safe for them. And so there's obviously some situations where we can't give, informed consent and more like emergency type situations, but for the more day-to-day, basic stuff or even different prenatal tests and things like that, it's really my job to provide informed consent by giving you your safe options and then letting you make a choice that's safe for you and your family.
Informed consent is somebody knowing all of their options and choosing what they want to do and knowing every part of what's happening with them and with their care. And it's really important for people to feel like they have that power to make those choices for themselves.
We really want to try to present all of the different options to you without telling you which one you should do. And so through the process of informed consent and shared decision making, we're really trying to just present everything. Like, these are the things that we could do. These are the benefits and the risks of all of those different things. And then the client lets us know which is the way they want to go.
One of the things that's really important about consent is placing a patient at the top of the decision-making tree, that you're able to really understand that family culture, background, education levels, so many different things come into play. And so allowing that patient's background to guide how you inform them and speak to them about their care and allowing them to make a decision as a partner with you, I think is one of the major components of consent.